I'm going to now introduce my colleague Katie, who's going to be doing the session with me. Hi, Katie, welcome.
Hi.
Hi,
We're Team
yeah.
Katy today,
Team
aren't we?
Katie, I know. Here we are. So we've had a few questions through already, so I think we'll start with those. And then, as I said, if anyone's got any questions as we go along, just feel free to post them. So our first question is from Stella, and she has asked, why do people who are 50 develop breast cancer?
Okay, Stella, and that's a really interesting question, and a lot of people want to know what are the causes of breast cancer and why do people develop it. And there is multiple factors that can influence the risk of getting breast cancer. There is no single cause. So we know that it's a combination of genetics, of lifestyle, of the environment, and all of those things together combine, and that will give you the cause for breast cancer. We do know as you get older, your risk increases. And we often say that the biggest risk factors for developing a breast cancer are being female and getting older, and we can't do anything about either of those things. So it is, unfortunately for a lot of people, it's just one of those things, and we know that the risk does increase. Anybody can get breast cancer at any age, but it is more common as you get older, which is why screening starts at the age of 50 as well, because that's, we know that the risk increases for people at 50. So
Yeah. Okay. Thank
so
you,
yeah,
Katie.
that's I
Yeah,
hope I've answered
difficult
that
one, isn't
question.
it? Yeah,
It
difficult
is,
one
and
to
so
sort of
many,
pinpoint.
yeah, and so many people want to know what's caused their breast cancer, and really,
Yeah,
you can't say. You're not really
no,
able to say that. A lot of people ask about genetics,
yeah,
and we know that actually only about 5 to 10% of breast cancers are due to a faulty gene.
yeah,
So the majority are not.
yeah,
But if you did have a family history, then we would recommend that you sort of talk to your GP about that.
yeah, definitely.
So another question that's come through, Katie, was about the survival rates. And again, this is something that people ask quite a lot of the time, and it's not always possible to give
Yeah.
a direct answer to that. But Lionel has asked, what is the survival rate for HER2 positive, PR negative breast cancer that's had a complete pathological response
Okay.
after neoadjuvant chemotherapy?
Yeah. Okay. Really valid question. Again, difficult to answer on an individual case basis. Really pleased to hear that there's been a complete pathological response. That's really, really positive news. With regards to survival rates, it's really variable, and it's similar, as you were saying, Katie, with regards to cause. There's lots of factors that come into play, really. As you mentioned, there's HER2, which is a protein found on some breast cancer cells, and some breast cancers are hormone responsive as well. Other things that are taken into consideration is the size of the cancer, whether there's any spread to lymph nodes, your overall health and fitness as well. So lots of different things. So it's not really possible to give give an individual answer to that. But as I say, really positive news that you've responded well to the chemo. It's a good question to take back to your team, because obviously they know your case. As an individual, they've got all the facts there, and it's not something everyone wants all the details of. But if it is something that you would like to discuss with them, I'm sure they'd be more than happy to spend some time doing that with you, and we'll be able to give you a bit more of a detailed response to that. Yeah, I think that's
Yeah.
anything to add, Katie, there.
No, I think
No.
you've answered that, and that's yeah, it's true. The way the way treatment is prescribed to people and given to people, and the outcomes all very much dependent on so many different
Yeah,
things,
that's
which is
it.
why everybody's treatment plan will be a little bit different as well, and that's
Yeah.
because they're looking at your cancer as an individual and tailoring your cancer treatment to that.
Yeah.
So
Which means that there's lots more options as well for treatment, which is really positive. And as I say, yeah, really good
absolutely,
news that you've had a good response to the treatment so far.
yeah.
Okay. So moving on, we've had a question from Lisa about soap substitutes. So I'm not quite sure, Lisa, exactly, what the question was. We can talk in a sort of more general term, I think, Katie, around that. But yeah.
Yeah, so Lisa, I wonder whether that's come up because somebody's advised you to use a soap substitute potentially after radiotherapy or something like that, which isn't necessarily something that would always be advised. But soap substitutes are more like the emollients, I suppose. Things like aqueous cream can
Yeah.
sometimes be used as a soap substitute if that's the sort of thing that you were thinking of. But generally speaking, if you've had radiotherapy, if you've had surgery, we wouldn't necessarily be saying you need to use a soap substitute unless your skin is very, very irritated and dry. We would be recommending more of an unscented, unperfumed, and maybe uncoloured soap to begin with that won't irritate you. And same with shower gels and any sort of thing that you put on your skin. But if you're not reacting to it, there's no reason why you can't use a normal a soap, as it were. So something
Yeah.
that's not going to irritate you, really.
Yeah.
So I
And
think.
I was just thinking, with the question, there's no evidence that soap itself causes cancer or does any harm, is there, Katie?
No, none whatsoever. So yeah, that's another thing that people ask sometimes as
You
well.
do?
But
Yeah.
yeah, so
Yeah.
so I don't wonder whether this was to do with radiotherapy because I know
Maybe.
somebody's also asked about how to look after radiotherapy during treatment and
Yeah.
products to use and what not to use. So I wonder if those two are linked.
Yeah.
And I wonder
Yeah.
if you want to sort of go through a little bit about things to look out for,
Yeah,
Katie.
yeah. So lots of women will have radiotherapy as part of their treatment plan. Not all need it, but yeah. So it's a really good question to think about how to care for your skin while you're having your treatment. There's lots of really good information on our website, and the Royal Society of Radiographers have also developed a booklet, which we will put a link to, but you can access via our Breast Cancer Now website as well. Generally speaking, radiotherapy can irritate the skin. It won't affect everybody, and it can affect you to varying degrees. So some people will have just a bit of gentle, irritation, a little bit of redness. Some people do experience some blistering of the skin. It is variable, and some of us are just a bit more sensitive than others. So it's something to keep an eye on. People often find that they develop some redness and irritation once the treatment's actually finished. So it can start to develop sort of week to 10 days after treatment, just because by the nature of the radiotherapy, it continues to work. So that irritation and soreness can continue afterwards. Generally speaking, settles down around 4 weeks after treatment, but again can be variable. With regards to looking after the skin, so as you mentioned, Katie, there's not really anything specific other than trying to use products that are quite gentle. So you want to keep the area clean, and when you dry the skin, just patting rather than rubbing. So trying to be gentle with that area, because as I say, it can get a bit more easily irritated, even if it's not red at that time. If you usually use a moisturiser, you can continue to use one that your skin is happy with. Some people like to avoid sort of scented, more sort of stronger moisturisers, if you like, just because it can be a bit more irritating. But again, there's no strict guidance around that. I think the main thing is don't apply it immediately before your treatment. So if you have a shower in the morning and you want to put a bit of moisturiser on and your treatment's in the afternoon, that's absolutely fine. But you wouldn't want to do it, just before you go in for your radiotherapy. Avoid sort of shaving, waxing the area whilst you're having your treatment and for that period afterwards. And as I say, just being a bit more gentle with the area. It's worth having a chat with your team that are going to be delivering the radiotherapy. So most teams you'll have a therapeutic radiographer. It's their bread and butter. They see people all the time with different reactions to radiotherapy. So if it's something you're concerned about, or you do start to develop some irritation, they may have some specific guidance that they recommend in their hospital. So again, have a little chat with them. But yeah, lots of information on our website and the Royal Society of Radiographers, which we will put some links to, which will hopefully be useful for you.
Yeah.
Yeah.
I think you've pretty much covered all of that, Katie. Just the only other thing I think to maybe sort of add to that is you're saying to talk to your team while you're having the treatment, and they will be keeping a close eye on you as well. So
definitely,
every time you go in for treatment, they'll be looking and checking your skin. But if you were to notice, and particularly when your treatment is finished, if you do notice any skin breakdown or anything like that, get in touch with your team. So get in touch with your breast care nurse or your radiographer if you've got a telephone number for them. Some people have specialists and radiotherapy team that you can contact.
Definitely. Okie dokie. So next question is around surgery. So how would you expect to feel after breast surgery? They're not specific with the type of operation, but we can cover, I'm sure, more general expectations there, Katie.
Yeah, and as we were saying with radiotherapy, everybody is different to how you react to surgery, and that will depend on so many things. It will depend on you, firstly, and your fitness and emotionally how you're feeling about everything.
Yeah.
But it will also depend on the type of surgery that you've had. So if we're thinking about surgery as far as something like a wide local excision or a lumpectomy is concerned, that you tend to sort of recover from that sort of surgery physically within a couple of weeks, and the same with a mastectomy. Actually, the stay case procedures these days, and people are encouraged to get up and move around the next day after surgery and start doing gentle exercises and moving and doing your daily activities. So we normally say that, it will take 2 to 4 weeks to fully recover from that, but you don't normally need analgesia for that length of time, and you will gradually build up to your normal level of activity in that time. If you're having surgery to the lymph nodes, so if you're having an axillary node clearance, for example, that can take a little bit longer to heal than a sentinel node biopsy and to recover from. It can be a bit more sensitive under the arm. Some people have things like seromas, which is a collection of fluid that can happen after surgery. That can delay healing for a little bit, and it can take a few more trips into the hospital sometimes just to be assessed and for that to be drained. Now, that's not everybody. So all those things to consider. And then if you're having a reconstruction, that's a bigger operation again, and the recovery then would be longer again. But again, people are recovering and don't tend to stay in hospital as long as they used to anymore with reconstructions. And there are a variety of different reconstructions. So something like an implant-based reconstruction, you may be in for a couple of days, you may be in for a little bit longer. If you're having a reconstruction using body tissue from somewhere else, you'll be in for a day or two longer, and the recovery will be a few more weeks. But equally, you'll always be encouraged to get up and to be walking around and mobilising. You'll be given arm exercises to do, depending on the type of surgery that you've had. You'll be encouraged to start doing those quite quickly after your operation, taking regular analgesia. So that's the physical side of things. Emotionally, everybody is very different, and it can take a lot longer than a few weeks to recover emotionally from this sort of surgery, because it's a big impact and it's significant. So it's something to sort of, don't beat yourself up if you're feeling that you're not back to where you wanted to be after surgery. There is no right way, there's no wrong way, there's no magic length of time. It's just however long it takes for you, and to take that time for yourself. And if you want to talk to anybody, you can always ask to be referred for some counselling, and Macmillan offer counselling sessions, 4 sessions on Bupa, so or your breast care nurse can refer you to, or you can self-refer into as well. And there are lots of other supports around, so always talk to your breast care nurse, or you can phone our helpline as well if you wanted to talk to somebody, if you just wanted to talk through how you're feeling after the operation and the impact that it's having on you.
it's a big thing, isn't it? Like you say, it's not just the physical, it's the emotional recovery as well. And the helpline's a really good one if you're not sure, after your surgery, should I be feeling this way, or you just want to talk something through. It's a really nice resource.
Yeah.
So
Yeah, absolutely. So I can see that there are some questions coming in, and just because we were talking about radiotherapy earlier, I'm just scrolling down. I think has it gone? There was one about radiotherapy.
Yeah, I can see a question here from Leslie. My breast is still swollen and red. I finished radiotherapy last July. Is this normal?
Okay, so radiotherapy changes can take some time to settle down, and it can take some months for swelling to settle. If it's still really swollen and it's feeling hot, I would definitely talk to your treatment team about that. If it's red and it's swollen and it's uncomfortable,
Yeah.
because it may be that you've got a bit of edema there, or maybe some lymphedema there. So I think it would be worth checking that out and seeing whether there's anything, if there's anything else that they can maybe offer with that, because it might be that you need some massage or something like that. If it's not hot and it's not uncomfortable, it may be that is just the reaction to radiotherapy, and sometimes you do have a permanent sort of redness after radiotherapy and skin changes. But if you're worried, Leslie, I would say go back to your nurse and just ask them to have a look at it. They'll be more than happy to do that. And they're used to people coming back with queries after treatment.
Yeah, definitely. Yeah, it's always worth getting it checked out, particularly if it's changed or it's something new that you're unsure of. So, yeah, just to get that reassurance sometimes, isn't it, Katie?
Absolutely, yeah.
There's a question here from Julie, which will follow on, I think, from our question around surgery. So she's asking about any good products for mastectomy scars. I don't know if there's anything, Katie, that you've come across, or
There's nothing that really we can't sort of recommend as such. A lot of people use things like bio oil, which can help. A good moisturizer, actually, just a good simple moisturizer, and moisturizing that area can really help soften the area and can help once you've healed. I wouldn't recommend putting anything on it until it's completely healed, and making sure that your treatment team are happy with that. But moisturizing regularly can soften that area. It depends what the scar is looking like. If it's looking more keloidy, there are certain products that you might be able to use. But again, if you talk to your breast care nurse about that, they may be able to recommend something, and they can prescribe them, and you can get dressings and things that sometimes people use for keloid scars. So that would be something to talk to them about and see. But moisturising is bio oil is often something that people do use, and in practice that's something that a lot of people have used from my background. Is there anything else that you'd like to?
I was just thinking it might be worth having a look on the forum to see if anyone's asked that question before. Absolutely. And if any other people have found something that worked well for them. It's always worth having a look. There's lots of information on there, so that might be another
forums are really
source.
Good signpost.
Yeah, definitely.
And a question that had come in earlier was from Pauline about lymphedema, and I know we just touched on that a little bit there, but this is about lymphedema. Can lymphedema start in the arm 12 months after treatment ends?
Yeah, so good question, Pauline, and one we get asked quite a lot on the helpline. Lymphedema can affect at any time, so it's always something to be mindful of. If you've had surgery for breast cancer, you don't say whether you're concerned you've developed it or if you're getting any symptoms, but if you are concerned that you are developing lymphedema, if you've got any swelling or discomfort, then again, it's worth getting checked out because there's lots that can be done to help. With regards to reducing risk of lymphedema, so if you're not experiencing symptoms but you want to know how to reduce the risk, mobility and movement is the best thing really for reducing the risk of lymphedema. So using that side as you would your other side. gentle exercise as well, and just moving the arm as you normally would, rather, because I think a lot of people are worried about that movement, whether they're going to do any harm or any damage. So it's much better actually to keep moving. Keep up the exercises that hopefully you were given post-surgery as well. All of those are designed to reduce that risk. But yeah, if you're concerned that you're developing a lymphedema, have a chat if you're still under your oncology team, and because it's a bit variable from area to area. But if you're still in touch with your breast care nurse, then and you've got concerns that you're developing some symptoms, then do give them a ring. They're very experienced in supporting and advising around lymphedema, and some places do have lymphedema specialists or physios that specialise in upper limb physio, which can be really, really useful as well. Otherwise, it would be a case of going back to your GP and having a chat with them so that they could re-refer you back in. But yeah. I think that's probably. Is there anything, Katie, that you would add
No, I
to that?
think you've covered all of that. We have got a
Yeah.
lot of information on our website,
Yeah.
so if you wanted to have a look at that, we've got about the signs and symptoms of lymphedema, and also about reducing the risk, as Katie was saying. So it's all written down there if you wanted to find out any more. And you can
Yeah.
also the lymphedema support network is also a really good resource for anybody that is concerned
Yeah.
about lymphedema.
Definitely. Yeah. Okay.
Okay, so I think they were most of the questions that had come in before.
Yeah. Yeah.
So I know Julie had asked about neuropathy after chemotherapy. Is there anything that you can do for that? So I mean, neuropathy is when the nerve damage can happen to your fingers and your toes and your hands and your feet after chemotherapy. It is something that can occur a little bit after treatment, and often it does resolve on its own, I would say. And it can be a case of just waiting. Occasionally it doesn't. There isn't really any treatment. I think I'd be right in saying that, Katie.
Yeah, definitely. I think the only thing would be if it was painful, but Julie said it's not, which is good. Yeah. But yeah, very annoying for sure.
Yeah, sometimes, if it's painful, things like gabapentin and those sorts of drugs can be prescribed. So that is something that can happen. But it's also just being aware, because if it is numb or you have altered sensation in your fingers and in your hands and it's affecting function, it's just being aware of that, so that wearing slippers when you're walking around the house, and being aware to check your feet and to check your hands to check that you've not injured yourself without knowing about it. Things like that. But you can always talk to your treatment team as well if it is causing discomfort, or if it's affecting your quality of life, and they can talk you through if there's anything else. And we do have some information on our website on that as well. And I think Macmillan has a good page on that as well.
Yeah. So. But hopefully, as you say, it will be something with time that will start to improve. Yeah. Okay. We've got a question here from Natasha, again, another one that we get asked quite a lot. Why do we not have tests when treatment is over to make sure the cancer has been taken, i.e. an interim ultrasound in between next mammogram? She says she's finished all treatments but won't have another mammogram until December, making her nervous to wait that long, fit and trying to get back to training. I think completely understandable to feel anxious around, this time. We get that call a lot, don't we, Katie?
Yeah, we do. And Natasha, you're as Katie says, you're not alone in feeling like that. A lot of people want to have as many scans as they can when their treatment finishes. But actually, the research has shown that yearly mammograms is the best way of picking things up. Ultrasounds aren't the best tool to look at breasts, and not in a screening sense of the word. So an ultrasound can be used if they see an area on a mammogram, that would then target that area. But to ultrasound an entire breast, it isn't very accurate, and you wouldn't know, because you wouldn't know what you were looking at. And that's so the best thing to do is to do yearly mammograms, because mammograms are the best tool to look at breast tissue. And other people sometimes ask about scans of elsewhere in the body, and again we would say that that's not recommended, and that's because the research says that isn't the best way of picking up early cancers,
Yeah.
or early recurrences, because what we want to be doing is you to be being aware of your body and being aware of any changes that happen, and reporting them. So it's difficult, and at the very beginning, when you first come out of treatment, it's really natural to be really worried about the signs and symptoms, and to attribute every change to the breast cancer.
Yeah.
And you're not alone in feeling like that. But if you are worried, we would always say to go back to your treatment team and to talk to them. And I don't know, Katie, if you want to just sort of go through the signs and symptoms of things to look out for.
Yeah, definitely. And I think I'd just add to that, the reason that, again, that they don't scan immediately when you finish treatment is that you get, depending on what treatment you've had, obviously, you can get a lot of inflammation and changes in the breast. And so if you scan too quickly, it's not always that useful. And it's much harder for the radiographer to determine, what's a normal change following your treatment, and what's of concern. So, but yeah, really, really difficult time. I think, thinking about things to look out for. It's really any new symptom that you can't explain and that doesn't resolve itself, over an expected period, really. So, it's important, again, to check your breasts. Depending on what surgery you have had, you want to check your healthy breast. And then if you've had a mastectomy, checking the chest wall, so the area along the scar line in particular, feeling any, under your armpit, anything really, as I say, that you can't explain. With regards to sort of thinking about symptoms of secondary breast cancer, I think, again, it's dependent on the area of the body, but same principles, really. Things that you can't explain, fatigue that feels different to just a normal tiredness, aches and pains that you can't explain. There's, again, lots of information on our website, and it thinking about these things can feel really overwhelming. So, but I think, as Katie said, if you're worried, do have a chat with your treatment team, and they can sort of talk it through, the rationale for why things are done in a certain time frame. But yeah, really, really hard.
And Natasha, if you've come to the end of your treatment and you are experiencing these feelings and these questions, which are very common, you might find our moving forward course helpful as well, because that's where we lots of people have these questions, and we're talking through how to manage once treatment is finished. So talking about things like the fear of the cancer coming back, and scans and returning to work, and all of those issues. So if you're interested in that, our moving forward course, it's on our website, and you can sign up, and you can either do them face to face or online. And they're 2 week, two sessions, one a week for 2 weeks. But people do find them really helpful, and it's nice to connect with other people that have been through the same thing as well. So.
And it is completely normal to have that anxiety as well, but it doesn't make it any easier, does it?
It doesn't,
No. We've got a question here from Karen. I'm still waiting for a mammogram. I was 50 over a year ago. So I think, correct me if I'm wrong, Katie, it depends on when your birthday falls. You would expect to be called for a mammogram between 50 and 53. Is that correct?
That's absolutely right. So it depends. Everybody will be called by the age of 53, but it depends. They call in sort of by GP practices, so it depends on where your area was last called. So it may be that you have to wait until you're 53 before you have that mammogram. But like we were saying before, if you notice any changes in the meantime, if you've got anything that you're worried about, then please do get in touch with your GP, and you can go and get, they can assess you, and if they need to, they can refer you for a mammogram or for an assessment in the clinic if they think it's necessary. But you should be called by the age of 53.
And you can contact the local screening units as well. So if you are worried, if you search for breast screening units in your area, there's normally a contact number, so you can at least have a chat with someone and find out when you might hear from them, just for that peace of mind as well.
Yeah, absolutely.
Okay.
Going through here, so Alison has asked, she said, I've got one lymph node involved. I had a full clearance, chemotherapy and radiotherapy, and I'm taking letrozole for 10 years. I was told it had to be 4 or more positive nodes to have a CT scan, so I just wondered why that was. So that's sort of linking in to the question that we had earlier about when you have CT scans.
Yeah.
So really, I think CT scans aren't routinely recommended for people unless there's an indication that the cancer has gone anywhere else.
Yeah.
So if you had 4 positive nodes, then your treatment team might think, well, that would be a reason to have a look at that, because that's cancer has gone to 4 of the nodes. But if you had 1 lymph node involved, and there was nothing else, was the chance, the thought is that the lymph node has done its job and it's not gone anywhere else, and it's caught that cancer there.
Yeah.
So they wouldn't be recommending that you have CT scans for that reason. And the letrozole, the other thing to say as well, and I think it's really important to emphasise this, all of the treatment that you have had is to reduce the risk of that cancer coming back. It's to get rid of it, and it's also to reduce the risk of that cancer coming back. So the surgery and the radiotherapy remove the cancer from the breast. The chemotherapy and the letrozole are reducing the risk of the cancer coming back in that breast, but also reducing the risk of the cancer coming back anywhere else as well. So you still are taking treatment and you're doing the very best thing that you can to reduce the risk of that cancer coming back by continuing to take your letrozole. So.
Yeah. Okay. What else have we got here?
Let me see.
So we've got a question here from Margaret. She had lobular breast cancer, grade 2, had 5 rounds of radiotherapy, and she's worried that wasn't enough. So Margaret, you don't say what surgery you had, whether it was mastectomy or lumpectomy there. I mean, the radiotherapy is given in different ways. So, I don't know if you want to explain in a bit more detail about that, Katie.
Yeah, of course. So radiotherapy is given in what's called fractions, and how many fractions of radiotherapy you have will depend, as we were saying earlier, about the features of your cancer, really, and what your oncologist will make that decision on what they think is right for you. So a lot of people routinely used to have 15 rounds, which might be why you're worried about having 5. But there is more data that's come through. There's been a trial, and there's more data that's come through to suggest that for some people, 5 fractions is absolutely, it gives as good a benefit, and it may be that they've given you an increased dose in that time as well. In those 5 fractions, so you'll be having the same amount, but you're having it over a more intense period of time. So that the outcomes are saying that that's the same thing it gives the same outcome. But I think if you're worried about that and you're concerned that you've not had enough treatment, do talk to your treatment team, and they'll be able to explain the reasons why you were recommended 5 rounds of radiotherapy rather than more than that. And the other thing is, some people will have a boost as well, and that will depend upon the type of cancer that they've had, and whether they feel, and the doctors and the team feel that an extra 5 might be needed. So everybody is different, and everybody's treatment regime does differ according to what's found on the pathology.
Yeah, and that's the difficulty, isn't it? I think, because you're seeing other people having this different doses of radiotherapy or different treatments, and yes, it's natural to question that. And but as Katie said, hopefully your treatment team will be able to explain to you why. The rationale for those decisions. So.
Now, there was a question further up that I skipped by. It was about the Mirena coil.
Oh, yeah.
Courtney had asked about whether it increases breast cancer risk. she's had it in situ for almost 4 years, and for the last 6 to 8 months, she's had very painful breasts every month, which is when she would imagine it would be cyclical for when her period was, but because she's on the coil, she doesn't have periods. And she's concerned that the hormones seem to be affecting me more. My mum had HRT-related lobular breast cancer 2 years ago.
Mm-hmm.
So, because that's a really interesting question, Courtney. And actually, even though your mum may have had a breast cancer, the advice wouldn't be for you not to have hormonal contraception. But if you are worried about that, then it may be worth talking to your GP again and seeing if there's an alternative that you can have. It sounds like they are hormonal type pains that you're experiencing in your breast, because they're happening every month. And it may be that you could talk about maybe switching to a copper coil if you would prefer to do that. Breast pain is not usually a sign of breast cancer, and particularly if it's happening regularly in a monthly cycle like that. But it's probably worth talking to your GP about that and seeing whether, if you've had it in for 4 years anyway, I imagine that would be due to be coming out soon anyway, and maybe if you wanted to discuss alternatives with that, and with your mum's history as well. So you don't say how old your mum was when she was diagnosed, or whether there's anybody else in your family that's got a history of breast cancer. But it might be worth talking to your GP about that as well, to see if you have got other members of your family, and depending on the age that your mum was when she was diagnosed, whether you might be eligible for some earlier screening as well. But I'm not saying that you are, because I don't know very much from that question there.
Yeah, it's always good to check these things, and I think the Mirena coil is progesterone only, isn't it? And it's releasing that hormone in teeny tiny amounts in a localized area. So very different to HRT, but always good to check with your GP, especially if you're worried, given your mum's history, for sure. So yeah.
Gosh, it's good. We've got lots of people sending questions in, which is really good. It's good to know that people are watching.
Yeah.
So Rachel has asked, can anastrozole cause muscle issues, and how do you check your breast when only the underside of your breast was left? And I've had a reconstruction already. So 2 questions in there, really, Rachel. The first one, yes, anastrozole is it can cause muscle and joint pains, I think, if that's what you're referring to. So it's what's called an aromatase inhibitor. So anastrozole and letrozole and exemestane, all of those fall into that category. And one of the most common side effects of those treatments is muscle pain and joint pain. Now, it depends how long you've been on that. Sometimes that can settle after a few months, but sometimes it doesn't, and it can be significant for some people. Some people manage it, and other people find it really does affect their quality of life. If it is affecting your quality of life, do talk to your treatment team, and see if there's anything. Tell them how you're feeling about it, and they may be able to suggest that you take a break to see if it is that's causing the pain, because sometimes it can be other things that are causing the pain. So if you came off it for a couple of weeks and the symptoms improved, they might then suggest switching you to a different type of hormone therapy, because although the side effect profile is the same for all of these on paper, lots of people find that they get on better with one than the other, and that's the same as well with the brands of the hormone treatments. Some people find that one particular brand suits them a lot better than another one does. So it's always worth talking to your treatment team if you are experiencing significant pain and muscle issues that are affecting your quality of life, because you're going to be on them for a long time, and it's important that you're comfortable taking that and your quality of life isn't affected. And the second bit of the question, would you like to answer that bit, Katie? It's how do you check your breast?
So we get asked this lots, and it completely makes sense, doesn't it? Because all the advice out there is based on when you haven't had an operation on that side. So really it's about looking for changes. So as you say, you've had reconstruction already. You don't say, how recent that reconstruction is, which again makes it difficult for you, because following the operation, there's a period of time where things are swollen. There might be, lumps and bumps and things, aren't normal to you. And so that does make it difficult. But as time goes on and things settle down, it's really about checking yourself in the same way as you would prior to your surgery. So same principles of looking for any changes, really. So get to know your body, familiarise yourself with your new body, and looking for anything that's new that you can't explain. Again, you can still examine under the armpit as well. Just again, anything you're not sure of, any concerns, going back to your treatment team or your GP, if you've got any worries there. But it is a difficult one to do when you've had an operation, for sure.
Yeah. And your threshold for going back to your treatment team at the beginning is going to be lower, and that's
Yeah.
understandable as well.
Yeah.
So if you are worried, we would always say go back to your treatment team,
Yeah.
because they won't know you're worried unless you tell them.
Yeah.
And they're very experienced, and they're used to people coming back to ask about things, changes of treatment, and it'd be much better for you to be checked out and reassured as well. And a lot of side effects from treatment, so radiotherapy side effects or surgery side effects, can feel like lumps and bumps, and they can be worrying if you don't know what they are. But if you're then told that is normal, you know that's your new normal for you at that point.
Yeah, so, definitely. Yeah. So Julie's asked about vitamins and minerals. So again, we get asked this lots, because there's lots of varying information out there. But Julie says she was triple negative, but sees lots of discussion about things she shouldn't take, like turmeric, things about estrogen. Is there any truth in any of this? So again, a really, really common question. Generally speaking, we want to be aiming to get all of our vitamins and minerals from our diet. So we've got some information on the website about healthy eating and diet, so you can have a look at that. But there isn't anything specific that you should be taking. Really aiming to get your nutrition from your food if you can. The difficulty with supplements and vitamins and minerals and things is that then they're not robustly tested in the same way as other medicines are, and so it's very difficult to make specific recommendations on that. There is a recent Facebook live that we did on vitamins. So if you have a look on our Facebook page or our YouTube channel, there is a really good discussion around that, which will give you a lot more information. But similar principles really is really trying to get your nutrition from your diet primarily. I don't know if there's anything you want to add there, Katie.
No, I think it's also worth just being aware that some vitamins and minerals can have interact with other medication that you're taking as well.
Yeah.
So I know you've said that you're triple negative, so you won't be taking the hormone therapies, but there might be other treatments that you're taking for other reasons as well. Yeah. So if you do want to take some vitamins, the Memorial Sloan Kettering website is a really good one to have a look at.
Yeah.
And we can put a link up for that for you, and you can put in whichever, say turmeric for example, in there, and it will tell you if it's contraindicated and what it interacts with as well. But I'd always say talk to your pharmacist and talk to your GP if you are going to take some vitamins and minerals, just to check that they are okay and then they're not going to be sort of interacting with any other medication that you're on as well. So and then
time for one more, do you think there, Katie?
I think so, yes.
We've got final question here from Chris, who says, I had triple negative breast cancer, lumpectomy, full node clearance. I've had chemo and immunotherapy before surgery, 5 sessions of radiotherapy and 6 immunotherapy after. I'm now 3 years of bone therapy, a session every 6 months, and yearly scans for 5 years. If no recurrence after the 3 years, is that the end of treatment?
Yes.
There's a lot of treatment to go through, isn't it? Bless you.
That is a lot of treatment, Chris. And you've been through an awful lot. But yes, once your bone therapy has finished, then that will be the end of your treatment. You will continue to have your yearly mammograms for 5 years, but you won't need anything else after that. So
yeah, I think that's enough.
Yes, I think you've had an awful lot there, haven't you?
Yeah.
And yeah, but so yeah, that would be the end of your treatment. So I don't think there's anything else really to add to that. It's just as again, when you get to the end of treatment, if you do have any questions, we're still here at the end of the line, and we often talk to people that are years after their treatment that have a question, and we're very, very happy to talk to you. So you can always phone our helpline.
Yeah.
I'm not sure if I gave the number earlier. It's 0808 800 6000. I'm sure it will come up in the chat as well. So do give us a ring. As Katie said, we're here Monday to Friday, 9 till 4, and on Saturday mornings.
Yeah. Thank you very much. I hope you've all found that useful, and thank you, Katie.
Thank you for joining us.
Thank you for joining us, everyone.